Let's take a look now at the plight of children during and in the aftermath of looting of shops in some parts of Gauteng as well as KwaZulu-Natal. I'm joined now by Dr. Shaeda Omar, who is the clinical director at the Teddy Bear Clinic. Dr. Omar, so good to have you with us this afternoon. We've been seeing throughout the day and throughout the past few days images of children going into the shopping malls, looting either on their own, sometimes as groups, and sometimes accompanied even by adults. Talk to us about the dynamics of this, what it is that gives children the confidence and I guess the bravado to be able to go and do that.
So I think if we just look at the fact that children usually look up to role models, they look up to authority figures, celebrity figures, icons, and these people that they've been following and responding to are certainly people who have some influence over them. And this seems to be propelling children to go along, to get along, the approval and the support. And I think from some of the reports that we observed yesterday, where a strappy young lad who said he was employable, but he experienced a sense of release and an excitement. And I think this is the kind of feedback and inputs that children are getting. And we speak, we have actually spoken to a child, and one of the children that we spoke to said, I just did it. I don't know why I did it. So it's about this influence, and of course violence begets violence, but at the moment children are so uncertain, insecure, the anxieties, the fears that they're surrounded by, the chaos and mayhem. So what do? They gravitate towards people who show power, might, authority. And what children are also learning from this experience is that if you exercise violence, what happens next? You get rewarded, the material rewards that are coming their way. So the kind of messaging that is conveyed to children, you don't have to work hard, as the ethos is with most children and families, that you need to strive towards earning and getting your stripes. So this is certainly a negative impact, and of course is going to have long-term implications for children and their behavior, disorderly conduct that is being condoned and that children are being desensitized to. It's normalized that this is acceptable because the masses are displaying and demonstrating this kind of behavior.
We've seen even yesterday, Dr. Omar, sometimes police stopping vehicles, and outside come out the mom, the dad, perhaps some uncles and some children as well, who have come from a looting spree. We've also seen images on social media, for example, where a young boy is stopped by two adults and they look in his plastic bag and they see that he stole some clothes, and they tell him, look, there's the social media. They ask him, what did you get? He says he got some clothes, he got some shoes, etc. And the adults laugh and they tell him to run off very quickly so that he doesn't get caught. Let's paint some scenarios here about the type of people and the type of men and women that we are raising, and the type of behavior that they're likely to exhibit in the future. And as you answer that, Dr. Omar, how can we try and circumvent the damage that has already been done and continues to be done when young people are part of sprees of this nature?
So I think what we see is a paradox. There's contradiction. So for a child, this is absolutely confusing because, coming from a family, the caregivers, the caretakers of the child are engaging in this kind of conduct, and adults that are actually laughing and supporting this kind of behavior, they're endorsing it. So for this child, that it's okay, it's normalized, and this kind of life is acceptable, and this definitely could create a career of offending. But I think also understanding that this could become addictive. So why addictive? The adrenaline rush. And I think we've received some reports, seeing on social media, where people have expressed the excitement and being so great about it. So for children, this adrenaline rush, and the next time they feel they're deprived of something or wanting something or in desperate want of something, that this is the easier way, the easier route to undertake? Why does one have to persevere and strive hard towards earning anything? So that's, something that we have to be very concerned about, because as adults, as a society, engaging in this kind of responses and conducting this kind of violence is actually sending a message to children that this is the way people, you can continue your life, and children learn to become then career perpetrators, career offenders, and the addiction, I say, as I mentioned, it could become an addictive pattern of behavior. It becomes a quick fix solution to many of their challenges, which they will fail to actually respond to and understand what they actually need to do and address the underlying concerns or experiences that they feel.
Dr. Shaeda, Omar, thank you so much for that perspective, the seeds that are being planted right now in the children who are observers as well as partakers. What type of adults will they be in the future after this type of role modeling? Dr. Omar is a clinical director at the Teddy Bear Clinic. Thank you very much for your time this afternoon.